So hi, everyone. My name is Jacqueline Lewy. I'm a fourth year medical student at the University of Michigan, and I'm looking forward to talking with you this afternoon about our scoping review, focusing on pulmonology, specifically the effects of climate change on respiratory care delivery. So we chose to focus our scoping review on these questions. How are respiratory care systems around the world experiencing the effects of climate change and extreme weather? How are these systems stressed by climate change and extreme weather? What literature currently exists regarding the improvement and strengthening of respiratory healthcare infrastructure against climate change? And how can we protect respiratory healthcare infrastructure against the effects of climate change? So I'll go over our search strategy. We included a number of databases, including PubMed, Embase, Scopus, Cochrane Library, Lens, and Google Scholar. Our inclusion criteria, we had qualitative, quantitative, mixed methods, studies, and reviews published between January 1st, 2008 and July 28th, 2023. Specifically, we were looking at papers that focused on the effects of climate change or extreme weather events on respiratory care delivery. So broadly, what does respiratory care delivery mean for our purposes? Anything to do with hospital care, emergency department management, or ambulatory clinic care for respiratory illnesses. We also wanted to include anything related to medication procurement, supply chain delivery of respiratory equipment, anything to do with telehealth interventions, as well as any other aspect of healthcare delivery that could potentially be relevant to patients with a respiratory condition. We looked at papers in English and also included anything in French or Russian based on the fluency of our team members. And we specifically didn't include anything that did not address climate change driven or extreme weather exposures, any papers that didn't mention respiratory care delivery outcomes, as well as commentaries, editorials, case reports, and opinion pieces. And for this project, we did not include a formal data quality assessment. So I'll give a quick overview of our consort diagram. Initially, we pulled over 1,200 studies. A few of those were duplicates. We ended up screening over 1,200 and then going over a little less than 500 full texts. And ultimately, we found 67 studies that met our criteria. So general characteristics of these studies. And I don't know if you can see my video, but I'm going to move it so that the graphs are not in the way. Okay. So the primary thing we noticed is that most of these papers were published very recently. So there's a histogram on the right, and it shows that there's a huge jump in papers focusing on these topics since 2019 compared with years prior. Most of these were observational studies, including cohort and time series analyses. The most common climate exposures that were discussed were heat, airborne particulate matter, wildfires, and extreme weather and storms. So on the bottom right is a pie chart. The medium blue, royal blue color is the proportion of studies that talked about heat. Underneath that, the orange slice of the pie talks about non-wildfire related air particulate matter, and then descending order, wildfires, temperature, storms, and other extreme events, and a couple other miscellaneous exposures. So the most common populations that papers discussed were children and the elderly, and this tracks given that the most common diseases that were discussed were asthma, which of course is common in children, and COPD, which is common in the elderly. And lastly, the most common healthcare system outcomes that were discussed were hospitalizations and ED visits. So going into that more specifically, so there are actually quite a lot of studies that talked about, that presented statistics regarding hospital admissions and emergency department presentations. However, most of these papers weren't looking at those statistics as markers of healthcare utilization or healthcare system, but rather as human health outcomes in themselves. So to say that in another way, if someone has asthma and it's exacerbated by a dust storm, they're more likely to present to the ED or hospital. And the authors were more interested in presenting the severity of their disease related to climate change rather than healthcare utilization in itself. On the right, we have a pie chart that sort of shows visually how many of these papers were looking at hospital admissions and ED visits compared with any other mention of healthcare utilization. So the darker blue color is hospital admissions, the orange is ED visits, and that's nearly 2/3 of the chart, and the rest were other healthcare outcomes that were studied. So themes that we found so far. First of all, unsurprisingly, climate change leads to increased healthcare utilization. On the right are a few papers representing the trend that we noticed. So we found that respiratory related visits go up with extreme heat, with poor air quality related to wildfire smoke, as well as poor local air quality related to other events such as dust storms, pollen, etc. So to go over some of the findings of these papers, for example, the top one coming out of England found a relationship between ambient heat exposure and COPD hospitalizations. Below that, another paper in California found a relationship between the amount of wildfire-related particulate matter and emergency department visits for respiratory and circulatory conditions. And then lastly, the bottom paper found a positive association between dust storms and the amount of air particulate matter related to that and ICU admissions in the United States. Another trend that we noticed is that also probably unsurprisingly, extreme weather events may limit respiratory care access, and that this was most striking for historically vulnerable populations. So on the right, the top article coming out of the New England Journal, it discussed that there are known poor health outcomes associated with traditionally underserved communities, for example, communities of color, but that these poor health outcomes additionally correlated with climate change related events and were worse with climate change related events. They termed this phenomenon the climate gap. And then another example of how different papers were looking at this topic were papers focusing on specific extreme weather events and natural disasters. So for example, on the bottom, there was a paper looking at the aftermath of Hurricane Harvey. That was a hurricane that devastated many parts of Texas and Louisiana in 2017, in particular the Houston area. What they found is that not only during and after the hurricane were people less able to access healthcare, they also found that that inaccessible healthcare was more likely to occur among people who already had trouble accessing healthcare before the hurricane. So unfortunately, what we can probably guess from this is that it reflects a state of poor respiratory care infrastructure currently. It doesn't bode well for infrastructure resilience in the future. And most likely these weaknesses in our system will become more apparent as natural disasters related to climate change and other climate change phenomena increase in the future. Lastly, I wanted to talk about another trend that we've noticed regarding power outages and conversely telehealth services. So talking about power outages first, they're more likely to happen after extreme weather events. I'm sure that anyone who's been through a nor'easter or a hurricane knows what I'm talking about. And that there were some papers that were looking at just the exposure of a power outage specifically and found that it's actually a risk factor for certain respiratory conditions. So for example, paper on the top right found that it's related to COPD exacerbations. Power outages are also important to think about as a component of the healthcare infrastructure in itself, because, well, I'll get into this in a minute, but first of all, talking about the effects on health in New York City, there have been a number of power outages in New York over the past couple decades. These have affected different areas, and even though they've been small geographies, because of the population density of New York City, of course, they've affected a lot of people. And this paper found that during a couple of these power outages, there was increased emergency department utilization after the power outages related to heat-related exacerbations of respiratory conditions. And then the last thing I wanted to touch about related to power outages is how it could potentially affect telehealth. So in the era of COVID, we've all become very familiar with telehealth services, and it can be a super useful intervention for patients who may have difficulty getting to healthcare facilities, and it can be very, very convenient for providers and patients alike. and it can be very beneficial. This paper found that telemonitoring reduces exacerbation of COPD in the context of climate change. But I also think it's important to think about telehealth in the context of this wider healthcare infrastructure. So it's probably less useful during a power outage when we need an electronic device that's A, charged, B, needs internet access or cell access. And all of these things can be diminished or absent in the aftermath of a natural disaster. So wrapping things up, gaps identified. So what we did not see in the literature that we think could be improved in the future. There's a dearth of literature on healthcare infrastructure impacts outside of those papers that were looking at healthcare utilization as a proxy of human health outcomes. There also really was not very much information on supply chain and medication delivery impacts related to climate change. We didn't find much related to healthcare delivery and infrastructure in the face of climate change. Also, we didn't find very many papers that had concrete recommendations on how we can make things better, how we can make our infrastructure more resilient. And importantly, there are large areas of the globe where this type of research with authorship representation and studies focusing on these geographic populations is just absent. So what can we take away from this, and what can we recommend in the future? We believe there should be an increased study of healthcare infrastructure as a primary study focus. We think that there should be more effort focused on other aspects of respiratory healthcare infrastructure, such as supply chains, resilience, and pharmaceuticals. And it's crucial that there are more research efforts on respiratory healthcare delivery in understudied areas. For example, the continents of Africa and South America, very little authorship representation or studies looking on the vast communities in both of these huge geographic areas. I think it's especially important to consider that because there are many vulnerable health systems in these geographies that may be disproportionately impacted by climate change now and in the future. So with that, I'd like to thank you for your time. Here are references, and look forward to answering any questions at the end of these talks. Thank you.